Good, happy Thursday morning, May 28th, 2020. I'm Riley King, and welcome to this Thursday morning edition of the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Thursday morning, so let's begin. First up, 9 Granite Staters die of COVID-19, health officials say. 56 more positive cases announced, 4 in people under the age of 18. Nine more Granite Staters have died of COVID-19, health officials announced yesterday. The announcement means 223 people have died in New Hampshire of the coronavirus on a day when official death total across the country hit at least 100,000. Health officials said 56 more people tested positive for COVID-19, including 4 people under the age of 18. A total of 4,286 Granite Staters have tested positive for COVID-19 during the pandemic. 5 more people were hospitalized for a total of 426 since the pandemic began. Health officials said 105 people are currently hospitalized. There are 1,372 current cases of COVID-19 and at least 2,691 people have recovered, health officials said. Now let's take a look at your COVID-19 in New Hampshire, what you need to know information. And here is that information for all of you. There are 4,286 number of people in New Hampshire who have tested positive for COVID-19. 1,697,459 number of people in the United States who have tested positive. 223 number of deaths from COVID-19 in New Hampshire. 426 number of people who have been hospitalized with COVID-19 in New Hampshire, and 100,271 number of deaths from COVID-19 in the United States. This map right here shows you where current cases of COVID-19 are in New Hampshire. Manchester, 414. This map right here of New Hampshire shows you where total cases of COVID-19 are in New Hampshire. Manchester, 1065. Now let's take a look at these 3 charts here. Let's start with new cases each day in New Hampshire. In the purple, new positive COVID-19 cases. In the orange, new hospitalizations. And in the red are the deaths. Let's take a look at this chart now. Current cases in New Hampshire. In the purple, current COVID-19 cases, and in the orange, current hospitalizations. And now let's take a look at this chart here, total cases. In the purple, total COVID-19 cases. In the orange, total hospitalizations. In the red, deaths, and in the blue, recovered. Now let's take a look at this chart here. Age group of cases. Female and male of cases. And risk information. And now let's take a look at this chart here, race/ethnicity of cases, hospitalizations, deaths, and percent of New Hampshire population. And your common symptoms: fever, lack of smell, cough, chills, and difficult breathing. How it spreads, and prevention tips. And be sure to stay with the Riley King Network for the latest of your COVID-19 information. State set to close 10 of 14 flex medical sites. Facilities were created to handle potential surge of COVID-19 cases. Let's take a listen to that video from WR News 9, Adam Sexton.
Beltate's building supply has been classified an essential business, and we take this responsibility very seriously. Now you have the option to place your orders via phone or email to orders@beltates.com for free delivery or curbside pickup. Stay safe because you matter to us.
Back in March, New Hampshire was bracing for a major impact from COVID-19 and the potential that hospitals could be overwhelmed. Governor Chris Sununu toured medical flex sites set up around the state where patients convalescing from coronavirus infections could be safely treated. But now that these beds have gone unused and the front lines of the pandemic fight have shifted to long-term care facilities, the state is closing down 10 of its 14 flex sites.
Unfortunately, as governor, my job is to really plan for the worst and hope for the best. And when we created these surge sites, that's really what it was for. It was for the absolute worst case scenario where our hospitals would be overflowing. Luckily, we didn't hit that point. I think the physical and social distancing really did work, and all the different other tools we kind of used at our disposal to ensure that we could maintain a mitigation of the viral spread did work.
The governor says cots will remain up and at the ready at 4 strategic locations: Manchester, Plymouth, Littleton, and Durham. While the other sites can flex back open if necessary, officials say it would require a dramatic increase in the number of COVID-19 hospitalizations.
The fact that the COVID hospitalization number is consistently at or under 100 beds at any given time ensures us that we have plenty of bed capacity at this time.
And the governor says the New Hampshire National Guard has become quite proficient at setting up these flex sites. And if there is some kind of a surge of COVID-19 in the future that requires the reopening of one of these flex sites, he says the Guard can get the job done in just a matter of hours. Reporting live in Concord, Adam Sexton, WMUR News 9.
Okay, and there you go on that video and that report. Dow features up more than 100 points after blue chip index rallies back above 25,000. Futures contracts tied to the major U.S. market index mostly rose early Thursday morning as investors looked to add to Wall Street's robust gains so far this week. More than 100,000 lives lost to coronavirus in the U.S. Let's take a listen to that video from ABC News.
Good evening, and it's great to have you with us here on this Wednesday night. And we have marked these difficult moments together, and they have come with astonishing speed. Just 3 months into this pandemic, and tonight America has just crossed that awful milestone. The U.S. has now reached 100,000 lives lost in this country from coronavirus. As we have done every night here, the numbers, and we have said it so often, these are not just numbers, these are American lives lost. Tonight, the toll passed that 100,000 mark. The searing images that led to this moment, the early scenes, the crowded emergency rooms, the shocking vulnerabilities revealed at senior centers, nursing homes, and long-term care facilities across this country. And of course, the heartbreak for so many Americans dying alone, their loved ones not allowed into the hospital because of fears of spreading the virus. Tonight, as the country now reopens, aware of the risks and hopeful that a vaccine could be coming, what Dr. Anthony Fauci said about that today. Of course, with the renewed warnings to keep our distance, our masks, even as this country reopens, to prevent further outbreaks, but to be prepared for any possible second wave. ABC's Eva Pilgrim leading us off tonight on the staggering toll.
In just 3 months, unimaginable loss across the country, from a nursing home in Washington state to overwhelmed emergency rooms in New York. 100,000 American lives lost to the coronavirus. The president traveling to Florida so far today, not addressing that milestone, but his rival Joe Biden did send out this video message.
There are moments in our history so grim, so heartrending, that they're forever fixed in each of our hearts. Shared grief. Today is one of those moments.
As the toll grows daily, states now scrambling to jumpstart their economies with a patchwork of precautions.
We are moving forward. Let us not forget the most vulnerable amongst us.
California, one of 14 states where cases are still rising. The state marking 100,000 infections, but today in most counties, salons reopening with temperature checks, gloves, and masks.
It's not burden at all. I mean, we're just trying to be safe for everybody, so there's no problem.
This demonstration showing in green how droplets of saliva are reduced when wearing a mask.
Stay healthy.
Without the mask,
Stay healthy.
the mayor of Washington, D.C. urging residents to wear masks as it lifts its stay-at-home order Friday.
We know without a vaccine or a cure that we will see new infections.
Dr. Anthony Fauci today saying he is optimistic about a vaccine.
I still think that we have a good chance, if all the things fall in the right place, that we might have a vaccine that would be deployable by the end of the year.
Tonight, iconic destinations reopening. SeaWorld in Orlando on June 11th, and Disney, the parent company of ABC News, today unveiling its plan for a phased reopening of Disney World starting July 11th, including reduced capacity, face coverings for guests and employees, social distancing, and temperature and health screenings. Our Rebecca Jarvis talking with CEO Bob Chapek.
In order to go to full speed, you got to start somewhere, and we're going to start from the beginning, and we're going to be very responsible in doing it.
The debate being faced by so many companies as they try to reopen in these uncertain times. And Eva Pilgrim with us tonight. And we've heard from so many Americans, Eva, who want to get back to work, but who want to be reassured that their health won't be at risk. And I know New York's Governor Cuomo today meeting with the president to talk about just that, how to restart the economy, but carefully in New York.
That's right, David. The two talked about how to supercharge the reopening here in New York, which was the hardest hit. The governor not mincing words, saying he told the president, we need help from Washington. David.
All right, Eva Pilgrim leading us off tonight. Eva.
Hi, everyone.
Okay, and there you go on that video and that report. And that does it for this morning edition of the Riley King Newscast, right here on the Riley King Network. I hope you all have a great rest of your day, and I'll see you back here later on today for another newscast. Goodbye, everyone.